6:33 in Trinidad and Tobago has moved right along this time, switching from the politics to the issue of Zika. And so far, Trinidad has recorded 3 confirmed cases of the virus. However, Tobago has no confirmed cases at this point. Zika generally presents with mild clinical symptoms. One symptom that features more commonly in Zika than dengue or chikungunya is conjunctivitis, popularly known as red eye. The Ministry of Health will embark on a number of initiatives to help treat with the challenge. And here to tell us more, we are joined by Dr. Maryam Richards, County Medical Officer of Health for St. George West. Thanks very much for joining us.
Hi, good morning
this morning, Doc. What's the status as far as the nation's readiness to cope with the challenges posed by Zika?
Well, the Ministry of Health has embarked on a very robust surveillance program in order to identify persons who may be infected with the Zika virus. This program really is done through both the private and public sector, where physicians and health providers, up until even involving laboratory practitioners, etc., where they send blood samples to the Ministry of Health, which can have confirmatory testing done at the Caribbean Public Health Agency. In terms of activities for readiness, the Ministry of Health has embarked on a very robust, again, health education program that is being done throughout the country. You would have noted that there has been intersectoral collaboration with the regional corporations from the Ministry of Local Government and the Trinidad and Tobago Defense Force, as well as the Trinidad and Tobago Police Service, to ensure that all citizens receive the relevant information regarding the Zika virus, and in some cases, areas where there is a high risk of mosquitoes, spraying and defogging is being carried out by the Insect Vector Control Division.
And we know there are a number of other illnesses that arise out of the Aedes aegypti, dengue, chikungunya, and some others and so on. But a lot of the issues surrounding Zika seem to have to do with the issue of whether there's a direct link to microcephaly, yes. The small heads, the smaller brains, and the complications that arise from that, and issues of whether or not women should even be getting pregnant at this time in a country where there is Zika. From what we know so far, you can correct me if I'm wrong, there's no evidence of Zika being fatal at this point. What is your own impression on the issues related to Zika? Is it a major health threat that as you would identify it?
Well, the Zika virus has been identified as a public health emergency of international concern by the World Health Organization, and that was done on the 1st of February 2016. And then in Trinidad and Tobago, our Minister of Health declared it a public health emergency as well. The significance of that is that additional resources can be channeled into research and into combating this disease as compared to others. Zika itself has really a mild profile as compared to dengue and chikungunya. In a non-pregnant patient, there are no significant risk or long-term risk. Again, with chikungunya, there is a long-term risk of arthritis, and with dengue there is always a high risk of fatality.
Yes.
However, in the pregnant population, a strong association has been found between Zika and the presence of microcephaly in pregnant women and in their children that were born. Of course, that results in delayed development because the brain is smaller. At present, the association has been determined to be very strong, but future laboratory examinations and testing needs to be done to actually point and give that direct causative link. That is being done currently, I think, in the Brazilian government with the assistance of the Pan American Health Organization. Now, as far as getting pregnant is concerned, that is a very personal choice. And at this point, the Ministry of Health does not advocate not getting pregnant or so.
And so therefore, what will be the major advisories being given now to the wider population by the Ministry of Health in relation to the Zika virus specifically?
At this point, we would like to inform the nation that the way to deal with Zika is to prevent being bitten by a mosquito. And the way to deal with being bitten by a mosquito really starts with having proper environmental health measures. So it goes back to really some sort of individual responsibility. Yes, the Ministry of Health is very concerned about the health status of the population, but still each citizen needs to exercise significant personal responsibility. And it's very simple. We start with simple things like ensuring that all water receptacles around your home are removed. If you have overgrown lots, or if there's one in your neighborhood, you either have it cut or you identify it to the relevant stakeholders, in this case, the public health departments or that of the relevant regional corporation. You use insect repellent, use preventive measures like mosquito nets, and that's where we start. Now, I would like to reiterate that spraying and fogging is not the solution. The solution is what we call in the Ministry of Health source and insect vector division source reductions. We really want to reduce the amount of mosquitoes. If there's an area that persons are infected in, or there's a high-risk area, for whatever reason, then the insect vector control division would come in and spray. But spraying itself is not the answer. One of the effects of spraying really is that over time mosquitoes develop resistance.
Yes.
So it becomes very difficult to deal with them when there is a true and real emergency.
And on the other side of things, because there will be, especially among the female population, those who are pregnant or likely to get pregnant and so on, there will be a higher level of concern. Are you seeing people going to health centers, going to medical facilities with maybe flu symptoms and concern that maybe they have Zika? Is there a higher level of concern in that area?
At present, we have not noted any significant increase in patients accessing the health service because of supposed viral symptoms. What we have noted, interestingly, is there's been an increase in citizens actually reporting environmental health issues, which we find very impressive, because at least citizens are really respecting and understanding that the Zika virus is really caused by mosquitoes and mosquito prevention is necessary. At this point in time, surveillance information from the National Surveillance Unit as well does not indicate an increase in the number of the other mosquito-borne diseases, dengue and chikungunya.
So if someone were to, right now, maybe having a flu, body pains, headache and so on, and wondering if it's just a normal flu and I just have to take my usual medication just to ride it through, what should I do in that situation? Should I have to go to a medical center for confirmation?
Well, usually in a viral illness, the first 48 hours or the first 2 days, you would be able to assess the degree or extent of that illness. We would advise people, if they are having fever and body pains and what we would term as very vague medical symptoms, to start with paracetamol tablets. That's the basic. If after 2 days or so your symptoms persist, then you should seek attention at one of the primary healthcare facilities. And in Trinidad and Tobago, we have over 100 health centers spread throughout the country. At that point in time, you would be assessed by a physician and the cause of your symptoms would be identified. Now, testing, when done, is not done solely for Zika. Persons with such a symptom profile would actually have testing done for Zika, chikungunya, and the dengue virus, because we are cognizant that all three are spread by the same mosquito and start with the same symptoms.
Someone was just calling into our producer just a short while ago and asking about the times of spraying that may take place. They're asking why spray early in the morning or late in the evening. Is that the best time, or is it that spraying can take place at any time during the day from your experience?
That's the current protocol that is being handled by the Insect Vector Control Division. The spraying profiles and times would really be determined by the medical entomologist, who would be able to identify when the mosquitoes are really more present. And
okay.
so.
All right, and just generally, would you say that you're encouraged by the response of ordinary citizens in the face of this virus and the possible consequences? Does that suggest that the more frightening an ailment is, or a virus is, that people are more likely to respond, and people seem to be rather blasé about dengue and chikungunya in comparison?
Well, I think the declaration of chikungunya Zika as a public health emergency in Trinidad and Tobago did raise the attention of the disease and raise its profile amongst the citizenry. Last year, the Ministry of Health actually did embark on a very good public education campaign with chikungunya. And in actuality, the percentage of the population affected by chikungunya was only 10%, when the estimates that were initially given the profile of the population, was 30%. So I think the response from the population with respect to chikungunya last year was excellent. And we are hoping to really have a more snowball effect with respect to the Zika virus and have an increased response. As far as dengue, the dengue virus is concerned, I wouldn't say that the population was blasé, but I think after, this is our third mosquito-borne disease, right, and after several years, they are now beginning to recognize the issue of personal responsibility, and that the prevention of this disease does not lie solely with the regional corporation or with the Ministry of Health, but really starts at home.
Indeed, it's better late than never, Dr. Abdul Richards. Thanks
Thank
very
you
much
very
for joining
much.
us this morning to give us an update on the Zika virus and indeed the overall situation as far as personal responsibility for many of us. It's one thing to talk about, then you come in and spraying by me and you have open containers all over the place collecting water and collecting mosquitoes and larvae and so on. So just be mindful of that. Personal responsibility is where it all begins. We'll take a break and come back for another interview segment before we reach the 7 o'clock hour.